Hey, good morning. Good morning, everybody. Good to see everybody on the screen or on the cam, seeing our list here. Good morning. I am Sarah Schmidt. I'm the president and CEO of the Colorado Health Institute, and I am so pleased to welcome everyone to our Hot Issues in Health webinar series. We are right at 8 o'clock. We are going to jump in. I'm doing the soft pedal to jump us in because people are coming out of the waiting room and logging on and grabbing their cup of coffee. There we go, because we have a lot to talk about today. So welcome. We are excited to talk with all of you who joined us this morning about the 2026 legislative session and the Polycrisis that the Colorado Legislature was navigating. It's good to have you all here. As we get started, I just want to name a couple of housekeeping issues that this webinar is being recorded, and we will post on our website later today. Second, we will have time for discussion and questions at the end after our presenters are finished. So please either jot down your questions or you can send them to us sooner. You can put them in the chat. You can also put them in the Q&A box that is at the bottom of your screen. And speaking of the chat, let's all use it for just a minute while we get our synapses firing and have a little chat conversation. So we are almost to the start of the unofficial start of summer with the long Memorial Day weekend right in front of us. So take a second and type into the chat what your favorite summer place in Colorado is. If you go to the chat, make sure that you have clicked everyone so that everyone can hear and can see your favorite summer place in Colorado. But let's share some happy summer places in our beautiful state. And I see them stream in, and this is amazing. Don't we all want it to be Saturday already? Oh, this is great. Love it. I'm not going to read them off because I would pick one to read and then I would feel like I made a, poor, they're all amazing. So hopefully everyone is looking at the chat. And if you're just joined us, type in the chat where you like to celebrate summer in Colorado and enjoy your beautiful state. So great to see everyone. Again, thanks for being with us. We are going to jump in. So before we get started, just want to give a quick mention about the Colorado Health Institute. For those who aren't familiar, we are a nonprofit public health institute. As you can see on the screen, we have been strengthening communities and systems with trusted analysis and collaborative solutions to improve health since 2002. And we do that in three ways: by answering critical questions, making sense of complex issues, and supporting others to reach actionable solutions. The Colorado Health Institute is nonpartisan. We don't lobby or endorse bills, ballot initiatives, or candidates. Also, I want to mention CHI does not receive direct funding or general operating support from government, either at the federal, at the state, or local levels. What we do is we offer our best analysis on the topics we examine and frameworks to make sense of complex issues like the one we are going to be talking about today. So let's get into it. We go to the next slide. So this is a quick snapshot of the 2026 session by the numbers. In some ways, it was a legislative session like any other, the second regular session of the 75th General Assembly in our state's history. As you can see, we had 626 bills that were introduced and nearly 3/4 of them passed. The Health and Human Services Committees were also busy with dozens of bills, as you can see, north of 50 for Senate and 70 for House Health and Human Services Committees. So lots going on this session. Yet when we sat down to analyze the themes and trends of the 2026 session, which our team does every year when it ends, we couldn't find a single theme that dominated the narrative as we have in previous sessions. And maybe as some of you have come to expect from these webinars that we do every year. However, we did in our conversation recognize that it was a very hard year that involved difficult choices and trade-offs. And the challenges this year that our legislators were facing didn't feel isolated, but rather interconnected. The 2026 legislature was navigating a polycrisis, and we want to share our thoughts with you today. What do we mean by a polycrisis? What did that look like for the legislature this year? And we are eager to hear your thoughts and your ideas about this as well. Because this year, we will talk about, this year was hard, and Colorado faces even harder decisions in the coming years. But Colorado, I know that we can do hard things. We've done it before, and there's more that we have to do. So let's get started on that. So with that, I am pleased to turn the presentation over to your wonderful presenters, my CHI colleagues who will introduce themselves in just a minute. Joe Hannell, Simon Mother, and Gerardo Silva Padron. Thanks everyone for being here.
Thanks so much, Sarah. I'm Joe Hannell, Communications Director here at CHI. I've been following the legislature professionally for more than 2 decades now, either at CHI or as a journalist before that. And I just have to say, in the last few years, especially this year, the range of issues and that they're having to deal with, they're just so varied and so many new ones. And I'm really excited to get into that with you all today. Simon?
Good morning, everyone. My name is Simon Mother. I'm a director here at CHI. I lead a lot of our nonpartisan policy work here at CHI, and I also work with a lot of our partners, whether they're in state government or other members of the community who are responding to and impacted by a lot of the changes and challenges that we'll be talking about today. Gerardo.
Good morning, everyone. My name is Gerardo Silva Padron. I'm a policy associate here at the Colorado Health Institute. Been here for almost 3 years. During my time here, I've been part of the legislative tracking team, and this is my second session covering the General Assembly with the team, and this one was by far the most unique. We had endless talks about the budget, last minute requests, lots of pivoting, and well, we're super excited to just share how this all ties into this bigger picture of the polycrisis.
All right, we've used this word several times already, polycrisis. What is it? Well, it's a set of crises that connect with and amplify each other. And the term's been being used a lot the past few years to talk about our global and national situations with just this swirl of different interconnected issues: war, climate change, tech disruptions like AI, name, 30 more. And I just want to acknowledge that those issues can really take an emotional and cognitive toll. It's just a heavy topic to talk about. But one thing that seems to help a lot of people is to define and sort problems into what's in our control and what's not. And then we can make a plan to address those things that we can control. So that's what we're going to try to do here today. Most of us on this webinar we're here because we're in part of the Colorado policy community in one way or another. Our context is Colorado state policy. So that's where we'd like to ground ourselves in this, our little share of the global polycrisis, and talk about what we can and have done about it. You could probably define the Colorado polycrisis a bunch of different ways, but we think it's useful to define it as problems that feed off each other and affect people's well-being in the state, and that we have a way, at least a little bit, to address through state policy. So that brings us to this model: 3 areas that required a response from the state legislature. We start with the state budget on the brink. This is a homegrown problem that is going to get worse because the second part of our model, federal policy actions, Congress and the president have passed some deep health and social cuts that are starting to take effect this year, and at the same time put the federal government's leadership in public health in turmoil. And as we'll show, federal policy itself is being driven by the third part of our model, online culture. even as artificial intelligence is claiming to get ready to disrupt major parts of our economy. So that's a lot to take in. When we first looked at the output of the legislature in 2026, as Sarah said, it looked like it was all over the place. What's the common thread in all these bills? But then when we looked at it through this frame of the polycrisis, it turns out that the legislature really was addressing this bigger picture. Maybe not always by design, maybe not always successfully, but lawmakers and the broader policy community were on the job, trying out some ideas that might work. Maybe it's a bill that failed, but it will lead to something that works in a future year. So this is the frame we're looking at the 2026 session through. And just to restate it, it helps to share our takeaways here in the three parts of this polycrisis. First, the state's budget is going to fall into deficit by 2030. Federal actions they required the legislature to react, but also made it harder. And artificial intelligence and internet culture are introducing a new set of dilemmas that lawmakers have to deal with. I'm going to start with this first section, budget on the brink, and pass it to my colleagues to discuss the next two. So the budget. This is one part of Colorado's polycrisis that isn't being imposed by Washington or Silicon Valley. There are some deep problems with our state budget. They predate this presidential administration, and I'll get into that now. But before we go into the budget, let's pause and look at what we're only half jokingly calling the most important document of the 2026 legislative session. It wasn't one of those 600 bills. It's just a 7-page memo from the staff director of the Joint Budget Committee, or you'll hear me call it JBC. And it's about the budget stress test. So what this was is the JBC staff projected out 3 different scenarios over the next 5 years to see what happens to the state budget. In the first scenario, it's a business as usual. Economy keeps humming along. In the second and third, there are moderate and severe recessions. What they found is alarming. In the scenario without the recession, the state budget falls into deficit by 2030. The scenarios with recessions are even worse. Don't look at them. The takeaway is this. The state budget cannot sustain its current trajectory. So that means by 2030, the state's 15% reserve will be wiped out. Think of it as your savings account is gone and you're basically living paycheck to paycheck. That would mean there's not enough money to pay for things that the state government does. And it's happening because costs and caseloads are growing faster than tax revenue. Taxpayers' Bill of Rights also plays a role here, but it's not the only thing driving it. So it means there's going to have to be some programmatic cuts all throughout the big things that government does. But this stress test memo focused on one particular program, and that is Medicaid. So before we talk about actual numbers, disclaimer that in this presentation, we're talking about the general fund. That's the portion of the budget that's filled by state tax revenues, and it's what legislators have control over. It's what pays for a lot of the familiar operations of government. So at CHI, we went and looked at the state general fund since the year 2011 and found it grew at an average rate of about 6.4% a year. But healthcare policy and financing, that's the department that runs Medicaid, as I'm sure most of you know, HCPF grew at 9.5%. Now, over 1 year, a gap like that is expected, it's manageable. Variance from the mean like that is not a big idea. But when you compound that over a decade and a half or more, it gets really big. And it means something gets squeezed. So what has been getting squeezed? Well, the big one is K-12 education. Now, this graph is going to show three slices of the budget. We've taken out the State Department of Education in gold here, all the other departments in green, and then HCPF, the Medicaid program, in dark blue. You see education, it starts as the biggest state department. And then through the years, we kind of bounce along and it starts to get squeezed a little bit here. Now, look what happens around the second year of the pandemic. Medicaid has displaced K-12 education as the largest share of the general fund. And that gold line for education has stayed pretty stagnant for the last 15 years. Well, we've seen this big increase in health spending. And this has happened despite Medicaid membership shrinking by 500,000 people during the unwinding of the COVID public health emergency. You see that here on this top graphic, the orange line is enrollment, and you see in 2022, 2023, Medicaid membership peaked at 1.7 million people, dropped down to 1.2 million a couple of years later. However, expenses on the bottom line just kind of continued ramping up as if completely separate from membership. These last 3 years are projections that the joint budget staff made. But you see it's not that those blue bars are not getting smaller. So legislators obviously noticed. They started to say that HCPF was being mismanaged, and a bipartisan majority of senators had signed on to a draft of a no confidence resolution in the executive director, Kim Bimsteffer. She resigned before that resolution could be introduced. But I'll tell you, in all my years of covering the legislature, this is a rare move for senators to essentially call for the ouster of a member of the governor's cabinet. But legislators themselves are also have to take some of the blame because they have asked for more Medicaid spending, especially in ramping up the rates that Medicaid pays for its providers. And they've resisted cuts over the years. I mean, they don't run for office because they like taking things away from people. But this year, they kind of had to. They had to make some real cuts in order to balance the budget. Those include cutting those provider rates by 2%. And the Joint Budget Committee had really tried over the past several years to ratchet those up. It was a tough pill for them to swallow. They had to cap the hours that caregivers are for paid caregivers. And these are, in a lot of cases, these are parents who have profoundly disabled kids who they have to require 24-hour care. And this money is kind of a lifeline to keep that family afloat financially. They had to cap spending on adult dental benefits in Medicaid, and they had to cut back a lot of benefits for Cover All Coloradans, which is the relatively new program that covers children regardless of their immigration status. So those cuts added up to about $270 million in the Medicaid program. But here's the problem. Even with those painful cuts, the HCPF budget grew by more than 6 times the size of those cuts just because of rising caseload costs. It points to a broader problem. The legislature voted for about $430 million in cuts altogether, including the $270 in Medicaid. But most of the budget balancing actions that they took were not from actually making cuts, but from borrowing money from special purpose funds. And by reducing the size of the state reserve from 15% to 13%. So remember, the stress test memo said that reserve would be wiped out in 4 years. It could be that we look back on this year as the year that reserve started to, that wipeout started. But there are 4 years between now and then, and there's time to act. And legislators know this. So in the closing days of the session, they set up a commission to study the future of Medicaid in Colorado. That commission's going to include 10 legislators, Democrats and Republicans. It's going to meet through the rest of the year. And it's supposed to figure out ways to basically put our Medicaid program on a sustainable path that ideally still keeps people covered when they really need it. So that's definitely going to be something to keep an eye on throughout the rest of 2026. And with that, with that set up on the state budget, I'll turn it over to Suman to talk about the second part of our model.
Yeah, thanks, Joe. So, as Joe mentioned, in the last year or so, the federal government has made sweeping changes that have had profound impacts on health and social programs. That includes signing H.R. 1, which is pictured here, along with a number of policy decisions over the last year. In many cases, a lot of these changes actually asked more of the state and asked the states to put more resources towards implementing a lot of these changes while at the same time cutting funding. This, of course, is never welcome news, but is especially not welcome news when facing a budget deficit like Joe described. But not all federal policy changes directly impacted a budget line item. Some federal moves really intersected with the growing influence of AI and online culture in a way that amplified and heightened anxieties and threatened the well-being of Coloradans in ways that the state legislature felt compelled to respond to, but without having the funding to do so. Let's first start by talking about some of these sweeping policy changes. Again, many of these came in the form of H.R. 1. When that passed last summer, it became very clear early on that there were going to be some pretty severe downstream implications on the state tax code because Colorado had made a decision long ago to link our state tax code to that of the feds. H.R. 1 also put forth a number of Medicaid eligibility restrictions and funding cuts, and these again hit Colorado especially hard, given that Colorado made the decision to expand Medicaid to additional qualifying populations back when the ACA was passed over a decade ago. Many of the provisions in H.R. 1 related to Medicaid, including things like work requirements and every 6-month renewals, apply to that expansion population. Next, H.R. 1 also included restrictions and funding cuts for the SNAP program, which provides food assistance to low-income Coloradans and people. It increased the cost-sharing burden on states when it comes to the administration of public benefits, meaning that states have to pick up a larger portion of the tab. Separate from H.R. 1, but worth noting here, is also the expiration of enhanced insurance subsidies for certain plans on the individual marketplace. And finally, potentially something that's not catching headlines in the same way some of these other changes are major reductions to the Colorado Healthcare Affordability and Sustainability Enterprise Fee. This fee is essentially what pays for that ACA expansion population in Colorado. And if these cuts are fully implemented over the next few years, we're talking about a reduction of billions of dollars to Colorado. So it was pretty clear pretty soon after H.R. 1 passed that the legislature needed to take action. And that special session met last August to first address this tie to of the state tax code to that of the feds. The August special session was able to sort of untangle the two. And this state legislative session, the legislature has been busy addressing and tackling some of these other elements. That includes finding ways to streamline and find efficiencies in the administration of public benefits. HB 1429 took a first step to consolidating the administration of different public programs like Medicaid and SNAP, and to find ways to reduce costs for the state, knowing that there are additional burdens coming from the feds in terms of cost and ask. Senate Bill 178, Health Insurance Affordability Measures, really just is a stopgap measure to bolster funding in the short term for things like those individual marketplace plans, reinsurance, and other programs like OmniSalud. And again, this JBC, perhaps to their chagrin, was essentially asked to set aside some additional funding in order to implement and comply with some of those additional HR 1 provisions. Next, let's talk about aggressive immigration enforcement from federal entities, including ICE and Customs and Border Patrol. While this hasn't necessarily impacted the state budget directly, the state legislature has tried to find ways to manage the real fears and concerns of many Coloradans without the legislature having the financial resources to really commit to this. In fact, federal sentiment on immigration has threatened the sustainability of some programs that Colorado had previously passed and allocated funds to in order to support immigrant communities. Joe previously mentioned the Cover All Coloradans program, which faced budget cuts as a result of the tightening state budget, but it's easy to sort of imagine that there likely is some of this federal sentiment that has trickled down to some of those decisions as well. Colorado responded specifically to this aggressive immigration enforcement component in a few different ways. First, the legislature introduced House Bill 1275, which would have prohibited state and local officials from concealing their face and provide additional requirements for law enforcement. This bill didn't pass, but it was a notable conversation at the Capitol during a time of heightened tensions and anxieties related to this issue. The legislature did pass House Bill 1276 to add and allow state oversight and inspections of federal detention facilities, and Senate Bill 5, which clarifies citizens' rights to sue over immigration enforcement action. I also think that many of us likely recognize the role that social media, tech, and even AI-generated content had in really amplifying some of the tensions related to immigration enforcement in the past year. And finally, let's talk about the federal government's Make America Healthy Again, or MAHA, agenda. The big headline to come out of MAHA this year were changes to the vaccination schedule, which essentially reduced the number of recommended vaccines and a departure from previously established vaccination guidance. Colorado responded to this by passing Senate Bill 32, which would allow Colorado to set its own vaccination standards using guidance from professional organizations like the American Academy of Pediatrics. Now, adjacent to the MAHA movement, the federal government made major changes to the structure and funding and the personnel in charge of major federal agencies, including the Department of Health and Human Services, which I think we all are aware is led by RFK Jr., who has been a leader of the MAHA movement for many years now. Many of the cuts to federal programs trickle down to state and local public health agencies because a lot of federal grant programs were either cut or severely restricted. The legislature actually didn't and really couldn't do anything to directly respond to these cuts. And if anything, state and local public health agencies got caught up in the tightening state budget as well and faced cuts of their own. Finally, it's almost impossible to talk about MAHA without talking about social media. MAHA and the MAHA agenda is really born from social media, and that continues to be true. These are just some images from the official Department of Health and Human Services Instagram page, and you can see sort of a mix of what might be expected and some things that really represent this administration's ability to use and leverage and be part of online culture. I think it's safe to say that all in all, MAHA and otherwise, this is a very online federal administration in every sense of the word. My colleague Gerardo now will talk a little bit more about sort of what this means in terms of some of the policies and decisions that the legislature weighed regarding tech in our next component of the Polycrisis.
Thank you, Suman. The last component of the Polycrisis that we'll be talking about is the role of tech, specifically AI in the internet culture. We don't typically talk about tech at the same level of the federal or state government, but It's becoming increasingly apparent that tech is playing a larger role in our lives, impacting our well-being and how we interact with each other. There's been a lot of concern over the way the high-tech industry is affecting our health and privacy. However, Colorado has been among the first states trying to deal with AI specifically. And we saw more of that this past session in the type of bills that were proposed. If there's one thing we hope the audience takes away from this section, it's this underlying theme of competing trade-offs that legislators had to navigate through. On one side, you have this balancing of economic opportunity and innovation. And on the other side, you have these efforts around protection, safety, and the well-being of Coloradans. Let's start with AI and some recent history. In 2024, Colorado passed the first in the nation comprehensive AI law, but implementation has not been smooth. It has been harder to find how enforcement would look like, compliance, and what responsible AI oversight should look like in practice. Then, when President Trump took office in 2025, he issued an executive order promoting AI and specifically calling out Colorado's law for interfering. This put Colorado's law in odds with the White House. And with this all in mind, again, AI is a very new technology and has left the pressure on Colorado policymakers to really figure out the downstream impacts of AI, while at the same time trying to create these safeguards around transparency, accountability, and consumer protections. Now, what are some challenges within AI and the health space? We all know that healthcare costs keep increasing and there's a provider shortage. However, AI supporters say that they have solutions for these problems. But legislators are worried about patient privacy and how decisions get made on medical care. This session, a few bills focus on this issue. House Bill 1139 looked at the use of AI in insurance and coverage decisions, including requirements for human review. Senate Bill 189 focused on transparency and protections against algorithmic discrimination across areas like healthcare, employment, and public services. Both these efforts are aimed at ensuring that AI does not become a barrier to people accessing the services they rely on. House Bill 1195 focuses on the use of AI in therapy and mental health settings. The bill really emphasizes that any use of AI in mental health care must still involve meaningful oversight from a licensed professional. However, the bill does permit AI to be used for administrative tasks such as note-taking or transcription, only if clients are informed and consent to the AI tools. Together, all these bills connect to a larger conversation around internet culture and policy challenges. And as AI becomes more normalized in our everyday systems, lawmakers and health leaders are being pushed to address questions around trust, accountability, misinformation, and the growing influence of technology in healthcare decision-making. Another topic we wanted to really highlight is around data centers. AI runs on massive data centers, and tech companies are spending hundreds of billions of dollars to build them. But there's a tension between economic development and the local impacts these centers create. Two bills, Senate Bill 102 and House Bill 1030, centered on the expansion of data centers that support AI systems. The Senate bill would have added regulations to data center construction. The House bill would have given tax breaks to new data centers. Both of these bills failed, but were among the most heavily lobbied of the 2026 session, involving nearly 200 lobbyists and around 150 clients, which just showcases just how high stakes and demanding this topic has become. And again, we live in a state that has always really prided itself on being a national leader in innovation. But as AI continues to expand, policymakers are weighing in the trade-offs, including the strain on power grids, resource consumption, and the potential effects this could have on nearby communities and the environment. Next topic is on youth safety. For many years, Colorado has focused on youth mental health and safety and the risks from social media and technology. There's good reason for that. There's a clear connection between social media use and poor mental health. CHI just actually put out a Colorado Health Access Survey report that adds to the evidence for this issue. And now with chatbots becoming increasingly accessible to young people, there's more questions about the potential risks and impacts on youth well-being. Several bills really reflected this issue. For instance, House Bill 1263 sets disclosure and safety requirements for AI chatbots interacting with minors. Senate Bill 51 requires devices and app stores to verify or estimate a user's age and share the age with apps to better tailor protections. And finally, House Bill 1148, which did not pass, would have created broader safeguards for minors on social media, including protections around harmful content and youth data privacy. Together, these proposals really reflect a growing effort where we're responding to internet culture in real time, where platforms are shaping not just how young people consume, but also how they think, how they interact, and experience mental health, especially in a space where misinformation can spread quickly and protections are still catching up. And the last part of the online culture that legislators really looked at this year had to do with sports betting. The Supreme Court allowed it in 2018 and Colorado legalized it a year later. By 2025, nationally, nearly 90% of sports bets were being placed not on a casino floor or a racetrack, but in a matter of seconds through a phone. Colorado has collected $36 million in tax revenue from sports betting this fiscal year. However, there is growing concern around the easiness and accessibility of sports betting and how it can result in gambling addictions, particularly for young people and men. We had a few bills reflect this issue. We had Senate Bill 131, which provided a handful of ideas to protect consumers. This bill prohibits the use of credit cards for placing bets, limits users to 6 cash deposits per day, and places more strict rules on sportsbook marketing, especially around marketing towards younger audiences. And then Senate Bill 163 took a broader oversight approach, such as adding options for people who want to block themselves from betting and also consolidating oversight under the State Gaming Commission. This all points to the center of the sports betting debate. While mobile sports betting continues to generate a great amount of revenue for the state, there's also this growing recognition that more attention is needed around gambling-related harms and its emergence as a broader public health issue. And really to rope everything together to the policy crisis, the rapid evolution of internet culture, AI, and technology, and balancing those with advances in health, safety, and well-being of Coloradans, it was a difficult and unique challenge for legislators this past session. With that, I'll pass it back to my colleague Summit to close us out today.
Thanks, Gerardo. So we've walked through a few of the ways that the legislature responded to the polycrisis as we defined and founded this legislative session. First, the state legislature received a fairly dire warning about the state budget deficit and made some immediate changes in the short term, as well as sort of set the stage for finding additional solutions longer term to really resolve this issue. Next, the state legislature was responding to a number of federal policy changes and often having to dig further into the state budget to do so. And finally, both of these issues all intersect with the growing presence of AI and internet culture. Legislatures were trying to understand and weigh the trade-offs between things like efficiency, innovation, and public will, with some of the concerns around privacy, environmental issues, and other ethical concerns. So this is how we made sense of the legislative session this year through the legislature's response to these three very big and challenging issues. In some cases, they did so successfully by passing bills, and in other cases, they raised bills for future conversation to really help understand how the state can continue to address some of these challenges going forward. But we also would be remiss not to acknowledge the hundreds of other bills that passed this session that don't necessarily fit squarely into this framework. So we did want to spend a few moments to acknowledge and recognize a few other key health-related bills that our team had our eyes on this session. First, the legislature passed a number of workers' rights bills, including House Bill 1272, which was related to extreme temperatures. This one's really interesting because it also really gets to that intersection between labor and climate. Bipartisan members of the legislature came together to pass competency reform for people who are not found competent to stand trial, also really addressing an interesting intersection of criminal justice as well as behavioral health challenges. Black maternal health equity was raised in the Capitol this session and addressed through passing House Bill 1044, which really aims to reduce the disparity in negative Black maternal health outcomes through a number of different areas. Applied behavioral analysis therapy was also a hot topic, and this is a type of therapy that is available to children with autism. It was actually a big part of the discussion around the Medicaid program, and this bill was passed to provide additional oversight of ABA therapy providers. And behavioral health continues to be a really critical topic for the legislature here in Colorado. Senate Bill 6 provided efforts to improve parity by insurers for non-opioid drugs, and a number of other behavioral health bills address things like the workforce, secure transport, and discharges after emergency holds. Now, outside of all the activity at the Capitol, we also know that Coloradans are doing their own work to really respond and tackle to the issues raised through the Colorado Polycrisis. One example are that voters and advocates are bringing forth a number of state ballot initiatives to really address the deficit. This includes addressing Tabor specifically, as well as finding other ways to raise taxes and increase revenue. And I know we at CHI, and I'm sure many others on this call, will be watching closely to the governor's race. Primary elections are coming up on June 30th, and Election Day will probably be here before we know it in November. And we're really curious to see how the next governor addresses some of these components of the polycrisis to really find a more sustainable way forward for the state. We also know that many of you are likely addressing these topics in your own way, and we'd love to spend our remaining time together here today, really understanding how others in the state are responding to these issues that we raised, and also what components of the polycrisis we might have missed, and how you all are thinking about those in terms of these interconnected issues that impact Coloradans' health and well-being. So with that, I think we will bring our panel back up and open it up to some discussion and some conversation. Again, we really want to hear, again, whether this is tracking with you, how you all are responding to the polycrisis in other ways, and what questions you have for us. So I believe that you can use the raise hand function if you would like to come off mute and speak. We also do have the Q&A open as well and can take questions that way.
And while we are waiting for questions to come in, and I recognize a lot of the names here. I know you're not shy. Go ahead and use either the chat or the comments field. Speaking of comments, in so many webinars, there's always like one or two more of a comment than a question guy. You know that person. Today, for something different, be that guy or be that person. This is we invite comments that don't necessarily have an answer or a question to it. We're all trying to go through this together. We need everybody's input. So yeah, if you
It looks like we
doesn't have
might
to be
have
Jeopardy. You don't have to phrase it in the form of a question. Go ahead, Simon.
I was going to say, it looks like Tara, perhaps you are willing to be our first commenter or question asker.
I am. Good morning.
Morning.
First of all, Tara Mistracchio, legislative aide for Jackie Phillips, House District 31. And thank you very much for the review. Absolutely, I watched every second of that happen in the legislature. And what I want to say is you'd mentioned Tabor and you'd mentioned the projection in the governor. Did you guys notice anything in possible changes? What in your projection might actually halt this devastation in 2030, or any decisions you think the legislature could make? Tabor's a big one. Tabor comes up in that conversation usually primarily, and the cut the ropes bill initiative that passed, it's going to get on the ballot, is a big deal. But anything you guys saw that comes up that you're like, hey, I think this could possibly push that dial a bit?
So for me, but I can jump in first, and then Simon Gerardo reply if you'd like. I saw this year a recognition on the part of legislators that this long-term budget discussion that's been going on, honestly, as long as I can remember, I saw them take that seriously this year. That Tabor has kind of given Colorado a structure that is just you can't sustain over the long term. You could argue that was the point of Tabor, to make government in its current form unsustainable. We're at a point now where that has to be addressed. You've got to either raise revenue or cut expenses, and there are honest efforts on both. This Medicaid commission, I think, is a very big deal. It's, the legislature is famous for creating commissions that it then ignores. This is something that can't be ignored. There are some ballot issues out there that are a very big deal. There's, you can argue it from both sides. It's a spending problem or it's a revenue problem. And there are ballot issues that address both sides of that. And so there's work going on and people are really engaged. And I also see a question in the Q&A field from Kelly. Can you tell us what makes you hopeful about the future for the budget in Colorado? I kind of want to tack that onto this. That it's all of that action, all that thought that does make me hopeful, because you just, at a time like this, you don't have any choice but to be hopeful. At CHI, I work with, it's like the smartest group of people I've ever worked with, and they're out working, doing projects for all of our clients who are just as smart. There's just a lot of energy in this right now. So the budget problem is something that we kind of created as Coloradans altogether. And that means that we can address it. I'm old enough to remember referendum C, when the budget looked even worse. And that was when there were like huge lines at the Department of Motor Vehicles, way worse than today. And it was just really touching people in a direct way. And a bipartisan group led by a Republican governor came together and solved that, at least for the medium term. It really helped in the ensuing decade or more that we're on from referendum C.
Thank you
I've
very
seen-
much.
Oh, yeah, thanks, Tara. I'm seeing a few questions specific to actually this Medicaid commission and sort of some of like the bigger picture things within the Medicaid program that can be reviewed and looked at. And, of course, we can't get in the heads of legislators or some of the folks making those decisions. And I think, one thing that has come up in the last few months, right, there have been some additional reviews of the Medicaid program through other entities. And they found, there likely isn't a single silver bullet that will like solve this issue. And frankly, I think we still don't totally know what the issue is that is causing some of those like divergences in the graphs. But it likely is a number of different things that will need to be sort of addressed head on. So again, I feel like that's an unsatisfying answer here, but one of the things that comes up a lot is this idea of managed care. Like, should we sort of rethink how that looks in the state? And I imagine that's something that will be re-examined or at least reviewed to identify whether there are issues there. But it is something that in some of the initial analyses that the state did earlier this year, they looked at and at that time determined that it wouldn't really swing things one way or the other budget-wise, but I imagine will be thought about again. Joe, anything else there?
No, I would, I mean, I could babble on, but got a lot of good questions coming in too.
Yeah. And I think a lot of these questions that folks here are asking are sort of the same questions that we heard legislators ask this session as well. Get some answers too, but I think still have some further questions. There's another question about, what can healthcare providers who largely serve under or uninsured populations really focus on, given sort of the large breadth and depth of a lot of these challenges? And again, these are really big issues. And so I understand like trying to find sort of the tangible things where we can really move the needle is sort of critical here. I'll speak to my own interest here, and then I would love to hear what Joe and Gerardo have. But I actually think this intersection of AI and healthcare is super fascinating. And I think we are still so early in understanding the appropriate use cases and consequences and benefits of using AI in a lot of different ways in the healthcare space, especially when we're working with certain populations who might be, more at risk of facing some of those unintended consequences. So I feel like as we continue to sort of grow in the space and find ways for the state to have additional regulations or ways to monitor this, it will be really critical to hear from those healthcare providers directly to understand how AI benefits and, in some cases hurts their work. But Gerardo, Joe, other thoughts on that question?
I'll just add because it's in my section, but it's an interesting topic just because of how evolving technology is in the past probably 6 years. I think we didn't really talk about, I guess kiddo youth mental health very young age until the pandemic. But I mean the involvement of AI, just how we interact with each other with technology advancing, it's really interesting that we live in a state where it really does pride on like taking the engagement, taking the considerations of healthcare providers and how maybe AI could like help benefit them in terms of administrative tasks. But I think again there's this trade-off of like how can we make sure that it's something that's controlled and it could be used as a tool rather to, take away from that human interaction. And so it's an exciting time to be in Colorado, and I think it's very exciting for the next governor and how this might be tackled.
Yeah. Yeah. You want to take the next question? I see one here that I was just shifting back to the slide that it talks about graphics showing trends of Medicaid and education costs. What's included in the third line? Let me try to bring that up right here. So this is again general fund spending. We have Medicaid or HICPUF in blue, K-12 education in gold. What's included in the third line is everything else. And for that means there are 6 big departments. K-12 education and HICPUF are 2 of them. Then there's also the judicial department, which is courts, corrections, which is prisons, higher education, and human services. All of those increased, but I was curious about this. So we looked back at it. The the really big increase was in higher education, and the state budget has had the way that it's structured, in part because of Tabor, is departments have to kind of build in funding protections in order to keep from getting cut. Higher ed doesn't really have one of those. So in previous recessions, it's like the thing that gets cut. And there's been a pretty concerted effort to boost funding for colleges. And you see that in driving this trend in the green line. Also, honestly, the judicial department in prisons, costs there are increasing. And we saw right kind of at the end of the session, the governor come in and say, hey, we need a new prison here. Sorry if I wasn't sharing that earlier. So but the short answer is higher education and then some in basically criminal justice. What should we take next?
Yeah, we have a few written questions that sort of speak to some similar themes. But again, if anyone wants to come off mute too, raise their hand. I think we'd be happy to take some questions as well, verbal questions. I think a lot of the questions we're getting are sort of like, what do you expect is going to come next? And like, how are people going to respond to these challenges? And I'll be honest, I think that we would love to hear from folks on the call too and see what people are
Yeah.
thinking. One thing that really struck me is, I think we tend to think of these issues like very much bucketed by topic, right? Like in the past, we're like, okay, we need to address housing, so we're going to have a housing bill. We need to address mental health, we're going to have a mental health bill, and that is important. But these things are also part of these broader interconnected trends. And so, in some ways, I'm curious to see if we will start seeing policy ideas that sort of more holistically address sort of different topical components that are sort of connected by sort of these common threads. And so, for example, are we going to see policies that sort of address the budget, but don't necessarily do so one topic at a time? And I know that's very difficult to do in government because of the way our funding works and how it is sort of bucketed out that way. But I think it's becoming increasingly more difficult to sort of tackle topic by topic when these things, you knock down one topic, it's just connected to another thing that sort of pops up. So again, I realize that's not specific, but it's sort of just a different frame of thinking for how to perhaps address some of these challenges.
Yeah, someone that gets into a comment or a question I see in the comments field from April, with making how cash funds can be used more flexible. Would that help? Cash funds are they're they're ba they're fees that you pay to government. So you buy your state parks pass, that's a fee. You register your car, that goes into a cash fund that's then dedicated to the Department of Transportation. Um, the legislature's actually already been fairly fairly liberal, not in the political sense, but fairly liberal with how they use cash funds. Those accounts get kind of drained during hard budget times and used to supplement the general fund. So it's, and the Supreme Court, the state Supreme Court has said that's fine, you can do that. So that's already happening, but it like someone said it, government is finances are structured in a really complicated way. And one of the things Tabor's done is give Colorado kind of like a user fee driven government. So each part of government has its own kind of little funding source. And when you try to Coloradans have almost come to expect that. Like when we say, hey, let's put a tax on marijuana. Well, that marijuana tax goes to public school construction. And then we can add another one for maybe it'll pay for some public health. There there's just not in the ordinary case, they don't have legislators don't have control that their colleagues in other states have over saying, all right, what's the priority? Because the decision's already made for how this department gets funded based on what their cash funds are. And then they have to wait for an emergency to say, all right, well, let's rearrange some things. It's just not a great way to do business. What should we take next?
Yeah, we do have
Kind of
about a
up in
minute
order. So,
left. So,
yeah.
I think that there are a lot of good comments here too about sort of the intersection of AI, job loss, and sort of the economic anxiety there too that we haven't really talked about as well. But a lot of questions about sort of has there been discussion about things like universal basic income and some of these sort of bigger, broader policy changes. And so I think that this session showed that legislators are starting to think creatively and really start thinking about issues that haven't been raised in the Capitol before. And that gives me a lot of hope and a lot of promise for what we can expect to see. And Colorado really is at the forefront of a lot of these things like AI.
Yeah.
And I am really interested to see sort of how that falls into the governor's race. But I believe we are at time. So Joe, maybe I'll let you have the final word here.
Yeah, that's all. Thank you so much. Yeah, we are. I too am hopeful. It's an election year. The change is always possible in a year like that. Elections are just kind of our built-in renewal process in America. So stay engaged. CHI will throughout the summer and fall in the year. Thanks so much for being here. It's great to see such a big crowd and such an engaged audience. Hit us up with questions. We will have an email going out either this afternoon or tomorrow morning with a recording and some resources. So see you around this year. Let's get to it.
Thanks, everyone.
Thank you, everyone.